All right, what is going on, everyone? So I'll give it a minute, let people hop in. For those of you that are in this live, where are you guys from? I'm recording this today out of my place here in Marina del Rey. So, topic of discussion today will be New Year's resolutions and everything that goes behind why someone may not meet their New Year's resolution and how you can overcome those issues. And then in addition to that, just making sure that you have the right mindset to uh, avoid the common issues that people fall into. It's actually interesting talking to a couple people that run gyms. You see a huge spike in gym memberships this month, up to 100% of an increase in volume of individuals they see that spike for January only. That's the interesting thing. And then February it starts dipping back down. And then of course towards the end of the year it just continues to decrease. Maybe there's a little spike in the summer, but January is a huge spike. But the problem with that is it does not maintain. So what I'm trying to help you guys with is avoiding that pitfall of going hard in January and then decreasing the exercise volume that you have the rest of the year. But give me comments. Let me know if you can hear me, if you can see me. Give me a thumbs up. And then for those of you that are in here, comment where you are from. Oh, I see. I wasn't on the right section. Okay. Okay, comments. There we go. Texas. What's going on, Cassandra? Yeah, so this live will cover all things New Year's related. But I do want to spend time at the end of the live, though, is answering any just open questions that you guys may have, just to make sure that I help address those. I know there were a few questions from Instagram based on the story that I posted. Can see what's going on. Maryland, Linda, nice, very cool. Actually, we're going to be in Maryland very soon. From Saudi Arabia, very cool. Oh, that's interesting. I can see which platform you're from. So that's from X. And then for those of you guys that are here, before I dive into the common issues that people fall into and how to overcome those, did you have a New Year's resolution that was revolving around health and wellness? The interesting part of New Year's resolution is over 55% of people, I've read up to 90% of people have some type of New Year's resolution that has to do with health and wellness. So I found that interesting, but only 9% of people actually stick with it for the course of the entire year, which obviously is not a good number. Saudi Arabia, nice. Two of you guys. Indonesia, about to go to sleep. Indonesia is an amazing place. I was there a couple of years ago. Did try January. Nice, Kinsey. Good job. So far, so good. Yeah, and I'll jump into common reasons why someone may not continue with their New Year's resolution, and then ask me questions as you guys are listening to me talk about this. So the first biggest one is a lack of motivation and interest. And the problem with this is that uh, people oftentimes try to bite off more than they can chew. They will make a goal of, I want to do an exercise routine for an hour a day, 5 days a week, when in reality, that is a great routine to work up towards. However, if you've not been consistent with an exercise routine, you can't just jump the gun like that. So what you want to focus on is just making sure that you have the easy win and you can create that behavior change for the long term. A lot of times people will try to overdo what they what they can do in a month when they're actually just trying to focus on the behavior change. So that first month is really about behavior change. And then after that, then you can focus on compounding, and making the goals a bit more aggressive. So if your end goal is like 5 exercise sessions in a week, each exercise session is 1 hour. Now that's a great goal for the end of the year. However, what you want to do is part task that by maybe starting out with 5 to 10 minutes a day for 3 sessions a week in that situation. So that's by far the number one issue that I've seen in looking at different statistics. That seems to be the problem. And it's because people get very excited, and I get it. Like, you want to make this big change, you want to get that change to happen as quick as possible. Athens, Greece, very cool. More people international than from the US. And then if you do have a New Year's resolution, please share. I'm curious to hear what it may be. So that's a big one. With the motivation piece, I think Delaware, what's going on, John? I think a big component of that as well is an identity shift when you want to maintain a behavior. So, for example, if I have low back issues, I am not someone that's doing a low back program to fix my low back pain. I am someone that takes care of my health and takes control of my issues, and I am going through this low back pain because of it. So if you identify yourself as someone that is an exerciser, for example, and I'm talking about exercise because that's the most relevant discussion point, but this is true for any other goal that you may have. And on this topic, like, you want to search for those easy wins. There's this idea of, like, let's say you have a bunch of different debt and you have different interest on those debt. It may seem obvious to pay off the debt that has the lowest interest rate, which is probably the move that makes the most sense financially. However, there's a school of thought to pay off the debt that is the smallest, so that way you can get that easy win and pay that debt off to go on to the next debt that you have that may have um, whatever higher or lower interest rate. But once you get that momentum, you can start winning and moving better into the direction that you want to move towards, whether that's saving money or exercising further. Whatever you're looking to do, you want to make sure to create that habit change up front. So yeah, comment your New Year's resolution. Curious what you guys are looking to do, or if you don't have one, that's fine as well. But what are some, when it comes to your health and wellness, there always should be some type of path or goal that you're moving towards. Marta, you're from the UK, going to bed. Well, we'll be recording this, and we'll email this out later on if you're on our email list. Okay, so Croatia, very cool. And the other piece of this as well is when people get very aggressive with their goals up front, you may actually even achieve that. So, for example, if my goal is I want to lose 10 pounds in I don't know, a 1 year period, you can do that very quickly in the first 3 months if you're very aggressive about it. However, 90% of people that lose weight will gain it back again. And every time you gain it back, you're less likely to be motivated to lose it because you're basically running this vicious cycle of losing it to gain it back. So the goal is to lose it slowly and to make sure that you keep it off. In that case, what you want to focus on is very slowly getting towards the end goal, and you're more likely to actually stick with it. So that's the big one with lack of motivation, interest, and I think that if you can focus on making it very easy and attainable, that'll set you up for success. And there's also this idea of emergency reserves of whatever your goal is. Let's say that 5 times per week, 1 hour per session. You have this emergency reserve of, let's call it 2 days per week. So you're telling yourself essentially, I'm going to work out 3 to 5 days per week. However, because you have that 2 days of emergency reserves, you don't feel like you failed your goal if you hit the gym 3 days a week. You feel like you are still within that normal range. But if you set your goal as 5 days a week and then you only go 4, you immediately think, I did not achieve my goal. Now I'm failing what I've set out to do. So you don't want to create that failure mentality, and you want to give yourself a realistic goal, which is why those emergency reserves are helpful. Okay, next one is a lack of time. So this one is a pretty common one, and I think that a lack of motivation can kind of leak into any of these things because you can always find time to do something. And this goes to the idea of you don't really need that much time to start to create a behavior change. Like Atomic Habits is a great book. James Clear outlines that a new habit should take less than 2 minutes if you want to stay consistent with it. So this is why just doing an exercise is a great place to start if you haven't exercised in years. That is, if you're someone that is pretty consistent with some type of routine, that's a different story. But if you're trying to build a habit from scratch, then just start with one exercise. Or if you don't read at all and you want to read a book a month, just start with a page. Once you get that page down every single day, you've built the habit of reading. Then you can start stacking on some more pages on top of that. That's why there's this notion of habit stacking and building habits off of things that you're already doing as well, because you're already going to be brushing your teeth at night, for example. At least hopefully you will be. And if you just read a book or read a page after that, you're more likely to stick to it than if you say, I'm just going to read a page at some point throughout the day. Or same thing with exercises. That's why this daily prehab that we have in the app is a great place to start for people that have not exercised at all. And it's one exercise every single day. We explain why it's important. And it should take about 2 minutes. If you tie it in with something that you're already doing, like I'm going to do this right when I wake up, because you should be waking up every morning, or right before I eat breakfast, then you will be set up for success a lot more than if you're just going to do your daily prehab routine at any point. And by the way, for those of you that are in here that are not on the app, we are giving out a 14-day free trial. If you comment trial within the chat here, what we'll do is send you out a link that takes you directly to the checkout page itself with that code automatically included. So just comment below trial and we'll make sure to send that out to you if you're not already on the app. And then if you are a app member, what program are you currently going through, for those of you here? I'm curious to hear. Trial, nice. Oh, okay, good. Yeah, Feta. I think you're from Croatia. You'll enjoy the app. I know we talked about the daily prehab, which is the 2-minute exercise routine. That really is just one exercise, sometimes bilateral, sometimes unilateral. That's a great place to start. Low back rehab. How's that going for you? I'm curious. I've actually been through that program myself. It's a great program. Um, one of our, it's definitely top three. It's probably close to number one in terms of the most commonly used program. Okay. So yeah, lack of time. Just start with something, and then the snowball effect will compound itself over time. That's why it's really good. Thank you. Awesome. Is your back starting to feel better? Hopefully so. Yeah, low back pain is a common one. That's one that really limits a lot of different exercise routines because it's in the middle of your upper body and lower body. So it looks like you're a bodybuilder. Assuming that photo that you have for your profile is you. John, neck and mid back prehab, also gym fitness. Oh, very cool. Yeah, for those of you that are uh, in the app, let me know if you have any questions as you're progressing through your programs: neck and mid back, low back, gym fitness. It's a 14-day free trial. Liu Bamir, sorry if I mispronounced your name. It's a 14-day free trial. So just comment below trial and we'll give you that link and you'll get access for free. It's not like you have to commit to payment. You just you get access, and then if you like it, you stay on, then you'll get charged, whether it's a monthly or annual membership that you select. Oh, that's Arnold Schwarzenegger. You do strongman though. Okay, very cool. Or strong woman. Yeah, so you have to lift a lot of load. You need your low back to be healthy. Yeah, after the low back rehab program, get into the low back prehab program. That'll build you up a bit more, and then from there, I mean, you probably are well aware of maintenance and being proactive with this kind of stuff. But you've got to maintain a few of these movements indefinitely to prevent these issues from happening long term. We use your app in our university PT clinic to email patients home exercise. Very useful. Oh, very cool. So you're talking about the exercise library. So the exercise library is separate from the app. It's a program builder for clinicians so you can send out programs to your patients and clients. I'm working through the shoulder program because of an inflammation. Yeah, absolutely. That's a very common this anterior shoulder pain, bicep long head. It's nagging, but if you shoulder prehab is a great place to start, as long as the pain is not very intense. If it's very intense, usually we say above 4 out of 10. At that point, the rotator cuff, actually more of the shoulder rehab program would be appropriate. But if it's more mild when you're doing certain movements, usually pressing movements bother you, then in that case, you're in the right spot. Hip prehab, completed hamstring prehab for high hamstring tendonitis and forearm last year for tennis elbow. Very cool, Linda. How did they do for you? Okay, so then this kind of goes into my third point of why people don't complete their New Year's resolution is that they just don't know what to do. They'll set a goal of I want to get out of back pain, or I want to get back to performing 200-pound deadlift for a strong woman competition, for example, and I am unsure of the correct steps to take. So, kind of what I mentioned in the previous point is it's about just starting a new habit and creating that behavior change. So as long as you do something, it's like me saying I want to build a network of friends and I don't know where to start, so I'm not going to talk to anyone. When you can just start with a text message to someone that you don't think is a great person, but it's fine. Like it's just building that behavior change. Same thing with reading a book. You don't need the perfect book; just read a page of a book, and that'll continue to move you the right direction. Same thing with an exercise. It doesn't have to be the perfect thing for your low back if that's your goal. Just do a movement and you over time you'll compound and progress towards the right things. So with that, for example, with exercising, I mean, there's a lot of different components to a New Year's resolution that may not be about exercising, but in that case, what I would focus on is taking our body scan. Our body scan makes it very easy for people to find where to begin. We do have a lot of stuff in the app. I'm sure those of you that are app members have noticed there's a lot of programs, there are even more workouts, and finding the right thing may be difficult. That's why the body scan is there. And if you're a member and you've already taken the body scan, you can take it again to find the next thing that you should be working on based on what your limitations are, maybe some restrictions or maybe some pain that you're dealing with. So we make it very easy after those questions that you take to guide you the right direction. So that's something helpful there. Another common thing that people deal with is injuries. That's a big part of setting people back. Yes, because of the injury, but also because it changes the habit again of, okay, I got back pain. Now I'm going to stop my exercise routine entirely until my back is healed. When in reality, there are a lot of different things that you can do to maintain, exercise strength, mobility, control while minimizing the amount of time that you're completely taking off because your body's going to atrophy if you do that. And back pain, for example, is something that oftentimes does get better within a 3-week period, but that doesn't mean that you want to do nothing for that 3-week period. You want to find ways to, if you're not at least improving strength, mitigating atrophy from occurring or minimizing your body from getting stiff. So there are a lot of different things that you can do to avoid that and set you up for success long term. Okay, those are some big items. Let me know if you do have questions on maintaining your New Year's resolution, or if there are issues that you feel like you may be dealing with, or maybe you're just anticipating some problems that may happen. Comment them below, and I can just start addressing it, giving you my thoughts on it. If not, you guys can start asking any questions that you may have. Usually, at this point, the conversation goes towards uh, rehabbing back pain, shoulder pain, hamstring issues, etc. So, whatever questions you guys may have, I'm open for the next 10 minutes. I follow your YouTube channel. I'm also a physiotherapist, and you guys are uploading very helpful exercises. Respect. That's awesome to hear. Thank you for the support. Really appreciate it. Yeah, YouTube has been a place that we've created content for a very long time, but we've definitely leveled up our content in the last couple of years. So glad that you found it valuable for yourself. Shoulder pain while pressing. Yeah, Feda, I think was it you that asked the question? Um, it might have been someone else about the bicep tendon. So shoulder pain when pressing. Now this can be a few different things. Someone mentioned bicep tendon, so that's the long head of the bicep right here that gets irritated when people stress their anterior shoulder by pushing like a press movement, or maybe they're doing an overhead press. So with this, it's yeah, usually either this or it could be the rotator cuff muscles. To be safe, in this case, I usually recommend the shoulder rehab program. If the pain is very minimal and it's only when you're pressing that you have a mild discomfort, in that case, you can go straight to the shoulder prehab program, which is a little higher level. But if you're unsure, I would start shoulder rehab and progress from there. I'd rather underdose than overdose. Kind of talking about this whole idea of you know, start light, you can progress quick, but if you overdo it and set yourself back, it's gonna take you longer to get out of that shoulder pain. Okay, next question, Linda. What do you think of using a power plate along with any of your programs to help reduce chance of help heal injuries? Yeah, power plates. That's an interesting one. It was something that was a lot more popular 10, 15 years ago. I remember when I was in PT school, even as an aide, it would be more commonly used. I think it could only help. I don't think it can hurt. I don't think that by itself will do too much either. The exercise and the load that you're putting on the tissue is ultimately the solution towards getting out of pain and getting back to where you want to be. So I'll say that if you have access to one, most people don't have access to one, and a lot of our content we try to make accessible and easy for people to use with minimal equipment. But if you do, I don't think it can hurt. It can only help, to answer your question. So hopefully that helped. I'm trying to look to see. You were talking about your hamstring rehab earlier, hip rehab. Yeah, for lower body stuff, I definitely think it could be a helpful tool. Matthias, my right arm falls asleep during running. Might be related to the inflammation of the bicep tendon, but I don't know. Should I stop running, or is it not problematic if the arm falls asleep during the running? Uh, so, so I'll tell you that the bicep tendon is a local pain. The bicep tendon should not create pain going down the arm. Pain going down the arm is indicative of something that involves the nerve. So what I would do, I reduce. Okay. Well, this is a tough one because you can push through it. A lot of people do push through it, but I would try to find ways to minimize the pain from occurring. A lot of times people will have, and this has happened to me when I did more long distance running, something along the lines of TOS where the shoulder keeps getting pulled down, the nerves keep getting stressed. And so over time, this creates some irritation down the hand. Oftentimes the ulnar nerve, like these outer two fingers. But in this case, what I'd recommend is building up the strength of actually your scapula and shoulders. I think that's a better place to start than working so much on the bicep tendon. And what I would do is probably start with the shoulder prehab program. And again, for those of you that are here, I'm not sure if anyone is new that wasn't here at the beginning. If you comment trial down below, what we'll do is send you a free 14-day code on the app. So all the programs, all the workouts that we have, get access with that 14-day code. And you can try out, for example, in this case, Matthias, the shoulder prehab program to make sure that your scapula is strong and stable to avoid that pulling sensation that's irritating the nerve. And again, it can be a few other things, but I'm going based off probability that it's likely coming from your nerve upstream, even though you may also have a separate issue of a bicep tendon problem. Hopefully that helped. What do you think about knee pain? What's your opinion on the topic? Yes, that's a loaded question. It's a great question, but I mean, let me know if there's a more specific question or concern that you have about knee issues. In general, I think knee problems are overused. I think if you, for example, have patellofemoral pain or meniscus issues, you want to maybe take a step back while the pain is there, respect the pain, and then find ways to load it up again. So once you load it up again, though, you need to make sure to actually load it where you're going knees over toes and you're and you're stressing the quads and the patellofemoral joint and tibiofemoral joint. All those joints need to be stressed pretty well to build up strength. So it's not like only muscles need load. The joints do also need some load in order to build and adapt towards. So I think that early on, respect the tissue, maybe offload it, focus on more hip dominant movements. And then as the tissue starts to feel better, start loading it up and progressively overload the knees in that case. Jeski, I love sciatic nerve glides. Can you talk more about these? They somehow help my thoracic pain. Yeah, it's nerve glides are crazy. They're something that definitely are overlooked. I think in people's rehab routines, they focus a lot on the source, which is important. Like, so for example, if I have low back issues and my low back issue is creating nerve pain going down my leg, it's very important I address my low back. However, you need to also address the sciatic nerve as well. And gliding techniques allow for blood flow to the nerve, because sometimes it's like it's almost, I'm trying to think, if you're, what nerve glides you're doing. You're probably doing more upper extremity nerve glides, but it's like flossing. So if your nerve is like this and it's stuck somewhere, it's not gonna get pulled because it's stuck here. So what you do is you offload this area and allow for the nerve to glide better. And you can see how my t-shirt is able to move. So what happens is there's oftentimes adhesions or areas that the nerve gets stuck. And if you find ways to kind of loosen it up, it offloads a lot of those symptoms. So in that situation of the runner here that had some pain going down the arm, if you focus on some nerve techniques to open up and offload that nerve a bit, it can help with your symptoms. Also, what you want to focus on is finding where the nerve is entrapped and stretching that as well. So if it's within my scalenes right here, then I want to stretch the scalenes to open up that tissue and allow for more space for the nerve to go through as well. But it's a very good technique. There's nerve gliders and then there are nerve tensioners. So tensioners are where you tension on both sides. So if I'm here, I'm going like this to the nerve, versus gliding is me going like this back and forth. That's more like flossing. Nerve tensioners are a bit more aggressive though. I wouldn't do tensioners unless you've done gliders and you made sure that gliders feel fine and tolerable for yourself. And also with nerve pain, be careful because sometimes there is a delayed effect in terms of the symptoms. So be careful with that. Don't progress too quick is my point. Cassandra had shoulder bicep surgery in May. Recovery is great. That's good to hear. I had been working on getting a pull-up before surgery. I've heard several say once you have shoulder surgery, you shouldn't work towards that. Thoughts? What surgery did you have, Cassandra? Curious. And I think there's a slight delay, so it may take a minute for me to see that. But what I will say is by itself, that's not a concern. Like if you're talking about total shoulder replacement, or even more aggressive is like a reverse total shoulder replacement, there are a lot of limitations that you may have there because of the anatomy of the shoulder. But if you just had something like a rotator cuff repair, debridement, bicep repair, distal supra in bicep long head. So what did they do? Did they repair the tissue? Was it a debridement? I'm assuming if it was just a partial tear repair. Okay. So in that case, again, like this is medical and I'd recommend consulting with your surgeon for something like this. But in general, you want to give it time. You don't want to get back to it too quick. However, the repairs nowadays are really good. They're strong. And back in the day, there was a lot of concern with people getting back to things that are going to load the tissue, because if you look at it from a surgeon perspective, the number one thing is making sure that the surgical site is not going to be damaged. So these advices were given back then, but now it's a whole different game. And there are people that get back to these kinds of activities, pull-ups, really heavy lifting again. But it takes time. It's not like you jump to that within the first 6 months post-op, especially with these tissues that are a lot more small, like a rotator cuff, for example. Four anchors in the shoulder. Yeah. So you do want to take your time getting back to it, but I wouldn't say that that's a contraindication to getting back to pull-ups. And I think that you should try to get back to doing something like that. I think that's a great goal that you have. And I'd work towards that very slowly though. Yeah, hopefully recovery is going well for you. And Angelique, I have been struggling with shin splints in my tibialis anterior. What rehab programs could help? Yeah, good question here. So the foot and ankle rehab program would be the best place because it addresses the entire foot and ankle region. There is a shin splint workout that we have that's a one-off thing, but you have to find ways to progressively overload. It should not just be a one-time thing. So that program is the best place to start. And remember, we do have the code. If you comment trial, we do have a discount code to get on the app for 14 days for free. So comment below trial if you haven't, and if you're not already on the app, and we will send you out that code. Okay, it is 9:30. I am going to hop off. I just want to make sure these questions that you guys have, great follow-up questions. I want to make sure that you guys have access to this code. So comment below trial 14. That's going to give you access um, to the app that has every program, every workout. A lot of the questions that you guys may have, if you go through the body scan, you will answer those questions and be directed to the right program for you. So that's likely what I'm going to be helping out with some of these questions. So if we did not answer your question though, I think there are a couple follow-up questions here about flossing, chronic pain, student physio. Please shoot us a DM. I want to make sure you get all your questions answered and we guide you to the right resource. We've already created answers to a lot of these questions, but I want to make sure that we guide you the right way and we're providing as much value as we can. So yeah, thank you all for tuning in. Make sure to comment trial for those of you that are still here. I'll stay on for another minute just to make sure that you do that. And what we'll do is follow up with you with a code that will automatically get you access to the app for 14 days for free. And for those of you that are already on the app, it seems like everything is progressing the right way. We talked to someone with low back issues, hamstring issues, hip prehab. There was a fitness program that someone was going through. So it's always good to hear the progress that people are making through the app, and happy that you guys were able to trust us and give us a shot to help you get out of pain. So thank you, Doc. Love your content. Thanks, Jesky. I appreciate the support. You do have the app, Angelique. Awesome. That's great to hear. Yeah, check out the foot and ankle prehab program, or I would start rehab and see how that goes. You'll work on building up a lot of that tissue, and as you progress, then you can go into the foot and ankle prehab program. Great. Thank you all for tuning in.